The Committee of the Whole is back from recess. Before we get started, I just would like to thank Senator Barnett's staff with the Committee on Rules for all the hard work they did to get the session hall back in order so that we can have session at 2 o'clock. So I want to thank the staff for working very hard and making that happen. At this time, I will recognize Senator Blas to introduce his bill, Bill 362-37.
Thank you, Madam Chair. Madam Chair, first off, I move to place Bill number 362-37 COR as introduced by myself, Senator Frank Blas Jr., Senator Joanne Brown, and Senator Jesse Guåhan, which is an act to add a new subsection 5215.1 to subarticle B, Methods of Source Selection, of Article A, Chapter 5, Title 5, Guam Code Annotated, relative to Special Crisis Procurement Authority for the Guam Fire Department to meet the criteria set by the National Fire Protection Association Standard 1710, and to ensure that there are sufficient stocked and equipped ambulances for emergency medical responses into the third reading, but I also would like to be able to speak to it.
Thank you, Senator Blas. Are there any objections for placing this in the second reading file for discussion? Third reading file, I'm sorry, the third reading file for discussion. If there's no objection, Senator Blas, you may continue. He's going to discuss, yes. In the second reading.
I have a point of information, Madam Chair.
Okay.
I made the motion, something I would like.
Your motion to continue,
okay.
And yes,
Thank
to
you.
discuss it. If there's no objections, seeing no objections, so ordered. However, okay, that being said, before you get started, Senator Vice Speaker, you have
Madam
a point
Chair,
of information?
I had a point of information before you gavelled just to make sure that we were clear if we were in the Committee of the Whole.
Yes.
And if we were going to call anybody in, but you're already ready to speak. So are we going on a point of information? Are we going to have any panel members come in on this bill?
Vice Speaker Barnes, we don't have anyone at this time. However, if the body does request to have somebody come in to speak, then we will pause and bring them in. They are standing by in the event anybody in this body would like to speak to them. In the meantime, we are proceeding forward. Thank you. Senator Blas, you are now recognized.
Thank you, Madam Chair. And I appreciate the concern and the point of order brought up by the Vice Speaker. Yes, Madam Chair, just to allay anybody's case, the fire department personnel will be on standby, and I'm sure there may be some questions. But, you know, Madam Chair, the reason and the impetus for basically the introduction of this bill is that I found it very disturbing that as little as last week, there were only 4 operational ambulances from the Guam Fire Department to service the entire island of Guam. What was most also disturbing was that the Guam Fire Department has been operating in that mode with only 4 fire ambulances, and at times only 2 ambulances since May of this year. And primarily because of the 15 ambulances they have in their fleet, okay, all but 4 of them were awaiting either minor repairs that could have been quick fixes to put the ambulance out on back on the streets as quickly as possible, or, you know, some repairs that may have taken some time. That said, though, is that this crisis that was happening on the island with only 4 ambulances, the reason why we had only 4 is because of basically the procurement process that existed to be able to repair and to deal with the other ambulances that were down. The Guam Fire Department has a standard that is set by the National Fire Protection Association, Standard 1710, which is the standard for the organization and deployment of fire suppression operations, emergency medical operations, and special operations to the public by career fire departments. And in those standards, and as set by the Guam Fire Department, what the fire department believes that they could safely and they could effectively operate and provide the adequate and sufficient coverage for our people is 8 ambulances. We only have 4. Well, you know, as of late, we have now 5. We're still 3 short. What does that basically mean for the people of Guam? That means that should they need to be medically transported, and I'll explain that a little bit later, but should they need to be medically transported, there have been instances, or there could be instances where, one, the ambulance service or the ambulance to be able to provide them the transport will not be available for them for at least a couple hours. And in at least one instance that I know of, the victim was actually advised by fire personnel, because of the medical services that she needed, that she be transported by her family members or friends to the hospital because there was no ambulance to take care of it. How can we operate like that? How do we operate in an environment today when health should be the priority? Health is supposed to be the priority. And it's not a matter of money. And I'll tell you why it's not a matter of money, because according to fire department personnel, they have the money to be able to make repairs. The needed repairs to be able to provide the minimally optimum amount of fire ambulances out on the, out into the community. It's not a matter of the money. It was a matter of the procurement process. Okay? It was basically like any other procurement process concerning vehicles within the government of Guam line agencies. It was competing with the processes for, let's take for example, for a Department of Labor vehicle, okay, or for a Kaha pickup. We are talking about an ambulance here, emergency medical transport. Now, if you were to bring the fire department personnel in here, they're going to say, well, you know, first off, there's no emergency because first off, when they receive a call, they will dispatch personnel there, albeit it'll be in a fire truck or it could be in a tanker, but they'll be able to provide the medical services as best they can. With a caveat, so long as that service that they need is not to be able to take care of major life-threatening situations in which a medical transport is needed. And so what this bill will basically provide is the opportunity for a special procurement, a crisis procurement process for the Guam Fire Department so that they can basically skip the level of regular procurement, fall right below the emergency procurement process, of which they say they have emergency procurement process, and my answer to them would be, well, why haven't you used it? You've got a crisis, and what this is to be able to address the crisis. So what this bill would provide is a standard or is a process.
Point of order, ma'am, time.
I'll shut up.
That's okay, Senator Blas. It is your bill. I'll allow 1 more minute to close.
Okay, what this will provide is, again, is a crisis procurement process to the Guam Fire Department to be able to procure the essential, the repairs as well as the parts necessary to be able to bring that apparatus back on the streets so that we can meet at least the minimum standard set of 8 ambulances, and we don't fall back to only having 4 or as little as 2 ambulances out on our community. Okay. So with that, thank you very much, Madam Chair.
Point of inquiry. Madam Chair, just on a point of inquiry, can you just clarify how much time the sponsor of the bill has to open?
Usually, unless I mentioned, it's about 5 minutes, but I'm allowing a little bit more time as the author of the legislation. And considering, I'm sure there's a lot of questions since we don't have anyone here at the panel to answer questions. I'm sure that the minority leader in his legislation knows quite a bit of information that needs to be given to this body. So I'm allowing just a little more time. At this time, so we're going to go ahead and Senator Lujan, you had a point of
Madam Chair,
information, or?
Yes, point of information, Madam Chair. Madam Chair, I know we'll be going around for questions and all that, but it's very again, thank you for being a co-sponsor, allowing me to be a co-sponsor. But I want to yield my time because I know there's vital information that the author of the bill will want to put out, and I'd like to yield my time to the author, Minority Leader Frank Blas. Thank you very much, Madam Chair.
Thank you, Senator Lujan. Senator Blas, if you would like to continue to provide additional information, please feel free to do it.
Thank you very much, Madam Chair, and thank you to my colleague and co-sponsor of the bill, Senator Guåhan, for this. I'd be remiss to be able to thank, the Speaker and the determination that this is an emergent and this is an urgent bill to be able to be deliberated and discussed on this floor because, again, it really pains me that we've only got a certain amount of ambulances available and that these ambulances weren't repaired or not on the street because they're stuck in the procurement process. And the procurement process that basically was obviously it was the normal procurement process. One would question if there was any urgency concerned by the administration that they could have used the emergency procurement process. But that said, they didn't do it. It's not done. And what this bill will provide is not just a measure to hopefully get things moving for the ambulances today, but we don't, again, that this crisis never comes up again because we give them the authority to be able to make the necessary procurements in a crisis mode with certain determinations. This is not just a carte blanche for the fire department. They have to meet certain standards to be able to rise or to be able to utilize the special procurement or special crisis procurement. And a couple of things. First off is you got to make sure that in order to be able to use this process, it has to be able to prevent and minimize serious disruption in emergency response operations as prescribed by the NFPA Rule Standard 1710. And it has to meet the minimum compliance standard set by the same 1710 rules, NFPA, as determined by the fire chief. So when they find that they're coming to a process that the ambulances that they need, it comes to a critical point where it's going to fall below the minimum of 8. They'll be able to use this process to be able to get it done. So it's not just for now, it's to ensure that it doesn't happen again.
Senator Blas, if I may, I believe we may be offline at this moment, so if we can just pause for a minute just to check the feeding of the line, okay? We're going to take a short recess. We're back from the short recess. Minority Leader Blas, you are recognized. Again, please continue. I'm sorry for that interruption.
No, I just don't know where I should start or where I have to start over again. Just to summarize, the bill provides the ability for the Guam Fire Department to be able to ensure that they'll be able to, in the area of the necessary repairs and the procurement, to put the minimum sufficient amount of ambulances on our streets, give them that special procurement authority to be able to bypass, not so bypass, because there's a criteria that has to be met to be able to get them to move quicker, faster on being able to procure the parts and services to bring the ambulances back online. Again, the impetus of this is to ensure that we do have more than 4 ambulances, or in this case, more than 2 ambulances that are services our island. Before it rises to that emergency portion, we don't want that. The ambulances are a 24/7 operation, the operation of it. So it behooves us to be able to look at it. They don't park it at 5 o'clock on Friday and come back to it on Monday at 8 o'clock. It's used 24 hours. Another thing, and as far as the consequence to having shortages of ambulances, now you imagine, you've got 4 ambulances that are running where there should be 15. Now, those 4 ambulances, these ambulances, again, they're operated 24/7. So you've got personnel that are on that bus, personnel that's on that ambulance, that's making run after run after run in a 24-hour period. It could lead to basically a breakdown and stress, as well as severe fatigue on the responding personnel to be able to perform their jobs effectively. So the unintended consequences of this is there may be some gaps in as far as the safety, the measures that are necessary to be exercised by fire personnel. We don't want that with our fire personnel. Nor do we need that for our community. When an ambulance rolls up to them, there should be some level of comfort that help is finally there and they'll be able to get to an emergency room. To have to wait a couple hours, to be able to get to an emergency room, or to be told by fire personnel that this is the best that we can do for you. However, now you need to get to the emergency room. Can you have a friend or a relative, take you there? That doesn't sound too, this is not third world country that we live in. We should be able to provide that, and providing them this authority to be able to do this will not only help to avert the crisis that we've currently got, but avert
Point of order,
a
time.
crisis that may exist in the future. Thank you very much, Madam Chair.
Okay. Thank you, Minority. We're going to take a short break again because of technical difficulty again. So take a short recess.
Mic check.
Committee of the Whole is back. We are having some technical difficulties to those who are listening, our audience. We are going to continue on, and in the event we get cut off, we will pause and come back online once we get feed back into play. So at this time, I would like to reiterate what we just finished. Senator Frank Blas just finished his opening with the good heart of Senator Lujan, allowing him his time. And now we are going to move on with Senator Chris Duenas. You are now recognized.
Madam Chair, and given the fact that definitely this is an urgent issue, however, we didn't have a public hearing, so I'm going to take my time to basically listen. I understand that the author and co-sponsors are encouraging the Guam Fire Department to come in and to have a dialogue back and forth. And so in my review of the bill, I can see some of the tools, I guess, to be placed in the toolbox in terms of enhancing procurement and the ability to have some temporary authority to be able to move forward beyond what the current procurement rules and regulations are. But having said that, Madam Chair, I think I'll just basically go ahead and in this round listen and for other details to come about, and then in order to be more educated on the bill. But I certainly see the need and hope to get some more information going forward. Thank you, Madam Chair.
You're welcome, Senator Duenas. Senator Parkinson, you're recognized at this time.
Thank you, Madam Chair. All my questions would be for the acting fire chief at this time. So at this time, I'd like to call in the fire department and ask some questions of them.
Okay, we're going to take a short recess to see if fire has arrived yet, and we'll be right back. Short recess. We're back from recess. At this time, I'm going to have Chief introduce himself, please. And he has been sworn in.
My name is Darren Burrier, Acting Fire Chief for the Guam Fire Department.
Thank you so much for being here. Senator Parkinson, you are recognized.
Thank you, Madam Chair. Half a day, Chief Burger. How are you today?
Good, thank you.
All right, so I too am very concerned about the reports about the lack of ambulances, so I'm glad you're in here to answer some questions for us during this emergency session. So, you know, we could make sure we get the best possible solution to help solve this problem. So, I understand currently there's 5 ambulances, correct?
Correct.
Okay. And that we have ambulances on the way to being repaired.
Yes, we have.
Without this bill, if this bill never existed or doesn't pass or gets withdrawn or sent back to committee, whatever, what is the timeline look like for this problem resolving itself?
Well, the current amount of ambulances we have is just, we have the 5 online right now. We have 2 waiting for, has a PO already, we're just waiting at the vendor for parts. We should have 7 back online within the next month. And then we have 5 waiting for requisitions to be put in to be repaired. And those repairs should be able to be accomplished within the next few months.
Okay. And the requirement for ambulances for a jurisdiction of our size is about 8, is that
8.
correct?
Correct.
And by the end of the month, or by next month, in a month's time, we will have 7 of them online?
That's anticipated, yes.
Okay, and then within the next few months, we should get at least some number between 1 and 5 more back into the fleet.
Yes, correct. That'd be the anticipation, and then we'd be back up to 8 within a few months, yes.
Okay. Because, you know, I'm always fond of doing things that will speed the process along. You know, I'm all about, you know, coming to this chamber and discussing and passing solutions. So I just want to figure out that if we do this, this will help solve the problem or at least improve upon it. So based on this timeline, if we were to pass this bill, how would it improve that timeline?
I don't think it would have an effect on it currently because everything's already in process. And the parts are being ordered, the paperwork is already being applied. That would all have to be done anyway on any kind of a procurement issue. So I don't see how it would affect at this current time.
So it would have no effect on the repair of the fleet that's already coming down the pipe?
Correct, because everything's already in the progress of being dealt with and handled. So, and then we also still have our contingency for responses that covers any gaps that we may have.
Yeah, let's talk about those contingencies. So in the meantime, while you are short your necessary fleets, what is the interim solution? How does the Guam Fire Department handle that?
Okay, you know, the thing that's different from the past is where firefighters were firefighters and we had our EMTs were all certified on the ambulances. And now it's required that all firefighters be EMT certified. That gives us a multidisciplined firefighter who's able to respond to multiple different types of emergencies. So with our ambulances in place, and their primary duty is to respond and transport sick people, injured people, we also have our fire trucks that are staffed with EMTs that can give aid at the scene prior to an ambulance arrival. We have our rescue units that have all EMT certified personnel, and they're also trained to give extrication and any kind of rescue activity that would be needed, like rappelling, close confined space rescues and stuff that would be able to aid people in any kind of a situation. And then we have our paramedic units, which are on a intercept unit. So if they're not busy on a ambulance call transporting a patient, they can actually respond to a scene and give care at the scene at their level through med control and in the services that they provide, which is a more advanced level. Our EMDs, their medical dispatchers, are trained for medical dispatching. So they are trained to triage calls. Not all calls that come in are high priority cases to where we need immediate response and transport, but we treat them all like that unless otherwise dictates. So if we got a severe case, they will respond in ambulance to that situation immediately. If our ambulances are busy, then we have the fallback of our mutual aid with our federal partners. So through DOD, we have a MOU, and we just updated it recently, for the use, and when we need it, then they will respond in ambulance to a patient that's in high priority and be able to transport and care for that patient on the way to the hospital.
Okay, so just so that I'm understanding this clearly, if we were to do nothing without this bill, we would get 7 of the 8 ambulances required back within a month, and in the interim, any gaps in our ambulance coverage will be covered with our various partnerships with other agencies, multidisciplinary ambulances, as well as our Fed Fire partnership.
Correct.
Okay, and this bill would not improve upon that process at all?
Not on the current process, no.
Not in the current process. Could it potentially help in a future process? Like, it might be too late to help now, but could it help in the future process?
I think with the proper planning, as we progress through it, we'll be able to anticipate anything and start preparing ourselves for future purposes, purchases and procurements of needed supplies, equipment, and parts. Everything goes through a process, and we have set that up. Our units are run for many hours a day, 24 hours a day, and it puts a lot of wear and tear on them. So a few months ago, we were at 4 ambulances. Those 4 ambulances are in for repair now. The 4 ambulances that were in for repair are back online. And then when we get them in, we should be good for a while until we also have requisition in for purchase of 4 more ambulances. And that is underway also.
Okay. And so, could this bill potentially complicate the process and slow things down?
Well, like I say, any help offered is always help. It's needed, is help that would be accepted. It's just that.
Because that's what I'm really trying to figure out. Does this help at all?
I don't see how it would help the current situation out. The situation we're in right now and going into the future, I don't see the exact need that I would put into it at this point, at the point that we're at now.
Okay, so just so I'm perfectly clear,
Yeah.
this would not solve the current problem that it's
No.
actually trying to solve?
No, it would not.
Would you consider our ambulance situation to be in an emergency situation?
I would consider, of course, our best resolution would have full 8 units. We go down and we operate at any given time where you can have an ambulance go down for a few hours, come back up for a few hours. And we have a fluid response capability with our system that we have that's set up now in order to triage our calls and everything and respond the appropriate units to give the best care. So I would not categorize it currently as an emergency situation with 5 ambulances running.
Yeah, and I'm always open to novel strategies to work around the procurement process, but this doesn't seem to actually help with any of that. And so I guess what I'm saying is, flatly, do you guys need this bill at all?
I say, I think the bill has good intentions. Everybody wants for the best safety of the people of Guam. The legislature, the governor, the fire department, everybody wants that. As far as the bill and how it defines the procurement process and everything, I'm not an expert on procurement. I depend on my staff and GSA to help with all those things. So as I would right now, in my current situation with our current fleet of ambulances already in the process, I would probably not avail to the bill if it was to be made into law at this time, because I think by that time we'll already have 7 ambulances online, and we'll have 1 coming.
Okay. Well, thank you so much for that. Thank you so much for that, because if we are in an emergency situation, as you, in your perception, I would be happy to support this bill or whatever legislation you need to accomplish your mission. But if this bill doesn't do it, frankly, I don't see the point of being here with this bill. So maybe at this time, I could like to make a motion to send this bill back into committee so it could potentially have a public hearing and have some further communications with GFD so that they could figure out what type of legislation they actually need to solve the problem long term, because it's clear from his testimony that this bill will not affect the current problem that we're in right now.
There's been a motion to send the bill back to committee without the other senators allowing to speak on it, so there's been an objection. So all those in favor of sending this bill back to committee, raise your hand. All those in favor sending the bill back to committee, please raise your hand. And the motion fails. Are you complete with your comments, Senator Parkinson? Or?
No, I got 30 seconds. I think I'll use the time.
Okay, you're recognized.
Thank you, ma'am. So, look, to the people watching, I'm all for helping to make sure that the fire department has their help. We've heard it straight from the lips of the fire department that this bill is not necessary, that there's a timeline already in place to get most of our fleet back online within the month, and it seems to be adding new rules to an already convoluted process. So I think, you know, whether this is an election thing or too much zeal to get it done, I think that it's a little premature. And with that, I yield the rest of my time. Thank you.
Thank you. Because we have the chief now here, we've had two other senators who haven't had the opportunity to speak to the chief, and I'd like to turn it back over to the author of the legislation to be able to ask questions to the chief at this time. Minority Leader Senator Blas, you are recognized.
Thank you, Madam Chair. And Chief, thank you very much for being here. A couple of questions, Chief. NFPA Standard 1710, you're familiar with that. I'm very, very sure you are, right? What is the minimum amount of ambulances the fire department needs to have out on the street?
We'd run with the standard eight
Standard
ambulances
eight.
for operations. Yeah.
Okay. Well, how many ambulances do you have now?
We have 5 ambulances.
5
running at this
ambulances. Okay. When was the last time you had 8 ambulances out on the street?
I believe it was at the beginning of the year. Then we started having our ambulances needing maintenance work.
Beginning of the year, and then maintenance, routine maintenance.
Not necessarily routine maintenance. I mean, the wear and tear, you start to get things that break down,
Right.
that is not normally routine, but then needs special parts, vendors that would have to order the part in and stuff.
Okay.
Yeah.
So why are we down to 5 ambulances today?
Well, right now, as when we were down to 4, we had 3 ambulances that were at vendor for, that were already had a PO, and we were waiting for their, the PO in the vendor to get the part. So,
Part.
Yeah, and so 1 has already been released, and we're waiting for 2 more.
When was that part, when was that released?
I don't have the exact dates on those.
So it was just PO, they just, could have been done. But we waited since the beginning of the year until now.
Well, these ones under PO are not the same ones that were out of service at the beginning of the year.
Okay.
These are a different set. So
Okay.
we already have those ones repaired. Now we're working on
Okay,
the ones that broke down since then.
Okay, you said that, somewhat to the effect that you had the ability of being able to bring them all up and not come down to 8 ambulances.
Yeah, from my understanding, talking with our maintenance division and everything, we have 2 ambulances currently at a vendor, waiting for parts to complete the repairs. We have additional 5 ambulances that are waiting for the requisitions to be submitted for when GSA reopens, and that process, then getting the necessary price quotes and sending out for a PO.
Oh, so you needed to you have to go to the regular procurement process to be, it wasn't a matter of money, was it?
Yeah, we're just, because these were ones that they went out of service after the fiscal year. That's why we're at that point.
Yeah, but
for those
you had to go to, you have to go through the regular procurement process to be
Yes.
able to. And this regular procurement process has been now sidelined you, and you're awaiting at least 5 ambulances to move forward, because you're going through a regular procurement process, and now the island is suffering and only has 5 ambulances. Right.
Right.
So, granted that you're saying that this bill may not be doing anything to fix the issue that we currently have today, with the processes that you have in. First off, if you have a process that have in, why don't you have 8 ambulances out on the street? Is it the Guam Fire Department's problem, or was it a GSA problem or a procurement problem?
Getting all the ambulances fixed, like I say, the current fleet that's operational has been the one that's been repaired from the beginning of the year. So as we move towards the end of the fiscal year in June, July area, then these other additional ambulances went down while the ones came back in. So then they put forth the requisitions then. We're able to get POs, and now they're getting fixed as the vendors are able to get their parts. And now the other additional ambulances that we have to get fixed, the 5 additional, are waiting for requisitions to be submitted to GSA when they reopen for that process. So I
You mean
don't
the
think
requisitions?
I think it's just the timing of the ambulances going down versus.
Yeah, but you just finished saying that this happened since the start of the year. Chief, are you telling me that the Guam Fire Department is not efficient in its operations to be able to, you can rotate out 15 ambulances to have at least 8. But you've had ambulances that have been down because of a procurement issue. It's not a matter of money, from my understanding. The fire department has already put in all the requisition requests. It's just a matter of the process moving forward in the regular procurement process, isn't it? So, and then to say that this is probably not going to be able to help you in the future? Wouldn't you think? Wouldn't the fire department feel a lot more comfort knowing that, granted that you may be able to take your routine maintenance and bolster that up, but you just finished saying it's a 24/7 operation. The vehicle can go down at any time.
Yes.
Okay.
Yes.
And having now with a process that will give you the ability to be able to fix that and bypass your regular procurement process, of which you're stuck in right now.
Yeah.
That's not going to help you?
Well, for right now, because the process is already I mean, everything's in process right now. But I'm not saying that any kind of help that we could use in the future to make the whole process work more expeditious.
Also, now this
I'm
bill
saying-
does become relevant.
I mean, any kind of help we can have to help us in keeping our units in line and everything, I'm always willing to look favorably at that.
So now this bill does become relevant.
Probably in the future, yes.
Yes.
Yeah.
Well, and let's face it.
Yeah.
It's probably because of the introduction of this bill that some fires were lit under some people to be able to move a process along. Because you just finished saying at the end of the month you'll have only 7 ambulances. 7.
Yes.
Your minimum standard is 8.
Yes.
So that process this process will not be able to get you to that 8. You just succumb to the fact that it won't be able to be done.
Yeah, by the end, it won't get us to the 8 by the end of this month, but, with the.
When does this
submission.
process end, Chief, is the question, okay? Is when does this process end? If it's at the end of the month and you're going to be satisfied with 7, how does that sound to the people of Guam when you need 8 and you're going to be satisfied with 7? Now, you also mentioned that you have, you're very familiar with JP 101, right? I guess your agreement with your federal partners? Mm-hmm. Okay. How many times have you had to activate that over the last 10 months?
I don't have the exact numbers, but I do know that we've activated them a few times, yes.
And a lot of times the caveat is if they have it available or they're not on the run, they'll be able to provide it to you. So depending on what their needs are, they may not be able to satisfy your needs.
Yeah, that's correct, yes.
Okay. This can explain why some people have to wait up to 2 hours for an ambulance to get there.
Yeah.
Yeah, I thought so. Or explain why an individual who needs to be who needs emergency room care is told by fire department personnel that they don't have the ambulances. They should ask their friends to transport them to the hospital. You're familiar with that?
No, I'm not familiar.
Well, it did happen. Okay. So, what are the average number of responses that your ambulances have in a day?
In a day, for the entire fleet, we can average between 70 to 120.
70 to
responses
120
Yeah.
amongst 4 ambulances.
Amongst 4 ambulances, yes.
Okay. Suppose it's 70 to 120 with 8 ambulances.
The number is usually about the same. I mean,
Yeah. Usually about the same.
Yeah.
Okay. So you put double the amount of pressure on 4 ambulances and four personnel, teams, than you would with 8. And you're good with that.
No, I know. I mean,
Okay. So then there is relevance to this bill at this point in time. Right?
it could be.
Thank you, Chief. Thank you very much, Madam Chair.
I'm sorry, could you repeat that, the relevance of the bill? I didn't hear it.
The relevance of it, I said, as far as currently, our process is in place. In the future, we could use, there could be a use for help in order to achieve what we need to get, if we come across a situation.
So it is relevant, it could be relevant, is what you said.
It's possible,
Okay.
as far as the way the bill's written and stuff, and being able to use it, and at the time it's needed, then it would have to be looked at, and it would be the best choice.
Okay, thank you. When you speak, just speak closer to the mic, because we're having problems with our
Okay,
sound system,
sorry.
so I appreciate that. Okay, thank you, Chief, for clarifying that. Senator Duenas, would you like to go this round, or, on the next round? Okay, so Senator Barnett, you are recognized.
Madam Chair, and thank you for joining us, Acting Chief. Maybe you could just, for the viewing public, explain the Guam Fire Department's involvement with the Guam Department of Education's sporting events and also the ISA sporting events? Like what type of assistance
Well, the
presence do you guys?
The sporting events, yes. Usually the sporting events, they ask for standbys, for some kind of medic standbys. If we're able to provide them with a standby, and it's according to availability, then we'd have like a fire truck or rescue unit that would stand by while they have the sporting event. If we do not have the availability, if our resources are, busy, then we recommend that the school find an alternate means to have somebody certified to be able for CPR first aid.
So it's safe to say that this shortage of ambulances, even though your department had said the public shouldn't be concerned about it, but that the shortage of ambulances is affecting the safety of the kids at the sporting events?
I don't think it's affecting the safety of the kids at the sporting events. They have the coaches who are trained to be able to take care of the sport injury. They can provide the school nurse or have someone else be on the standby for it. But to have an ambulance there, we try not to have an ambulance at sporting events anymore because it's mainly used for transports of patients, to respond and transport patients. And a standby is just having an EMT certified personnel that are able there to provide care until we're able to have them transported.
Yeah, because I've gotten this football season, I've gotten some texts prior to games of people just asking if there's anyone EMT certified so they could start the game and have personnel on hand.
Yes.
How long is this crisis, or you said it's not an emergency, but the shortage of ambulances, I know it's only recently reported in the media in September, but has this been something that's been happening all year?
I know during September it became an issue. I was acting for a short time in September, and then became the acting in October. So when I came in, we're at 4 ambulances, and I was made aware that we have ambulances that were in for repair, and we're waiting for those to get repaired at the vendor, waiting for the procurement to get them parts in. And then we had 5 that were waiting to get requisitions in, and those were all ambulances that had broken down. My understanding was after the fiscal year had ended, to where GSA had closed, so we were waiting for that. So now we're getting our ambulances that are at the vendors fixed.
I get it. I get the position you're in. I understand, you know, that someone's running for governor over there at Adelup in 26, and we can't have any more crises happening. But again, how long were we short? How long did we only have 4 ambulances? You said that you were made aware of it, or it was publicized in September, but it kind of sounds like, just based on the line of questioning from the minority leader, Senator Blas, that you've actually had to engage in your agreement with the feds and other partners to come and help because we've been so short. And
Yeah.
then that's contingent upon if they even have services available, right?
And we've always had a MOU with the military, and they average anywhere between 50 to 150 runs in a year, responding to our help, to help us on responses. I do know that we've had our ambulances fleet down to 4 this year, and then it fluctuates back up and then comes back down. And that's where we started getting towards September, was the fact that units went down unexpectedly, and now in the process of getting everything back up. So the fleet of 4 has been, I think for the past couple of months, we were running on 4. And then now we're able to start bringing that number back up again.
So now that we've clarified that the bill will actually could assist the Guam Fire Department, I'm just wondering if we had entertained this measure earlier in the year, could we have avoided a lot of these shortages that we're not? And I get it, you're saying that, it's going to be all hunky-dory in a month, but you know how things go with procurement and whatnot. I mean, I don't even know if I agree with that.
Yeah, I'm not sure. I couldn't speculate on that. I wasn't acting chief at that time. From the way I would look at it, the bill is a great intention. It has all good intentions for the betterment of the safety of the people of Guam, and and I think that we all want that. So if it's something that could help, it would be appreciated, and we need to see how it works out.
In September, it was reported Guam Fire Department had only 4 of 15 ambulances currently working, right? I believe your spokesman had advised the public that they shouldn't be concerned about that, which I thought was interesting because I had gotten a lot of communications from people who were very concerned, who, as the retiring speaker had said, who had to wait 2 hours for an ambulance call. There was even an instance where someone was told, "I'll just transport them yourself." So maybe you could explain a little more that statement. I mean, is that something you're telling people in Guam, we only got 4 ambulances, don't worry about it? Is that...
I'd have to reflect on that, the statement from our PIO. I wasn't sure the exact verbiage, but I would imagine that...
I got it. It should not be concerning for the public. The ambulances provide transport. However, if emergency is called, we have our fire engines, rescue units, and...
Okay, yeah. So it's a reiteration of the fact that we have our fail-safes within place in order to make sure we get qualified emergency medical technicians at a location at any time. And that has not really been a delay as far as getting help to the scene in one way or the other. It's the actual physical ambulance getting to certain scenes at the right time. So I do know that there's been cases run up about concerns for getting an ambulance sooner. It also works well when the information is being provided appropriately. So we want to make sure we reassure the public that we do have enough EMTs that can respond to the scene. But we do, at that time, had the 4 ambulances, and everybody would be concerned about the numbers of ambulances we have. But we all make sure we reassure them that we do have additional units with the capability of taking care of these people.
I just felt like it was a little tone deaf. We only got 4 ambulances. Don't worry about it. That's what people were very worried about it. Just going back to the schools, do you really tell the schools to use their nurses and coaches in the event of
we make
emergency?
recommendations. We try to be there for them as much as we can, and have our EMTs there, but it's always to availability.
Yeah. So give me an idea, because I hear a lot of times that they're not at the games. And, I just shudder to think, kid breaks a leg, nasty break, then they, are now hopefully not having to wait 2 hours for an ambulance to show up, or hopefully not told, hey, coach, hey, nurse, go transport them to the hospital. So do you have any definitive information on like the number of sporting events GFD is able to provide a presence at?
No, I don't have a current number of sporting events that we were not able to provide standbys for. I know we have the requests, and then it's handled on a daily basis at the time of the call. I do remember when I was in the field and being on an ambulance and being at a sporting event.
Me too. We used to always have, there was nothing to worry about, and
Yeah.
we got $1 billion budget, and now it's like the kids are getting shortchanged. I mean,
But I also remember too being at a sporting event and being there for the first 5 minutes and being called on an actual emergency and we have to leave. And that is the reality of the job that we have is there's emergency can happen at any time, and we have to use the resources within that area in order to respond to that call. So and it goes back down to the schools, and we understand that they want to have us there. Everybody's more reassured when we are physically there, and we want to be there. But if there's a reason why we can't be there, then our dispatch does they're the ones responding our people, doing the call taking and determining the availability of units and when they can be where they need to be.
and in the event there's an emergency at a sporting event, then you guys
We will
respond accordingly.
Yeah, we will make sure we get a unit going there.
Yep. So you had said that you were made aware of the shortage of ambulances when you assumed the acting fire chief role. Is that what you said?
When I actually assumed as for appointment, it was October in beginning of this month.
And you had no knowledge of the shortage?
But I was aware we were down to 4 and that there was already a process in place getting those ambulances up and running. So the timeline I have for getting those up, they were in for requisition, getting the PO established, and then going to the vendors.
It's common in talking to some of your firefighters, very common situation where, you know, for example, we've got 4 now or 5 ambulances now. You've got the other 3 are waiting for parts, right? But is it very common for you to get 1 ambulance up online and then have 2 go offline for similar maintenance?
It happens, yeah, it happens. We can have, 8 ambulances up and running at the start of a shift, and then one of them has a transmission issue, another one can have an air conditioning issue. Then our mechanics, a lot of times they do miracles and get them back up online, and other times they need to get parts to replace, or they purchase the part if it's easy to get and repair.
Yeah, and I think the intent of the body is to give you enough to work with, to make sure that you have, X amount of ambulances and you're insulated from these, rapidly changing numbers. So I hope you can appreciate that. And if there's any way we could get more presence at the sporting events, just, for the kids, I'd appreciate that
And
too.
we will do that.
Thank you.
If we're able to, yes.
Sidos Masi, Madam Chair.
You're very welcome, Senator Barnett. Speaker Tristulahi, you are recognized.
Sidos Masi, Madam Chair. And thank you, Acting Chief, for being here, and congratulations. I
Thank you.
understand you're going to be nominated. All right, can you just, for me, the bottom line is really, how did we get to this situation, and how do we prevent us from getting to this situation again? And, I don't understand the debate as to whether this is an okay situation to be in or not an okay situation to be in. You said at first we require 8. We should have 8. We only have 5. So are we okay, or should we have 8? Or should we have 15? Because it seems like from some of the articles I'm reading, we're supposed to have 15.
No, we don't have 15 for operations. We've never run 15 ambulances for any operations configuration. It's always been basically 8 ambulances that run at a time, and then we have backup ambulances that are used when ambulances go out of service. Pre-planning and planning for emergencies, for ambulances being down, we do that, but still the wear and tear that's put on the ambulances, unexpected things do happen. Things break down, and we have to get them repaired, so then it can at times start to build at inopportune times. And of course it's a concern, and to use the terms okay and not okay, Of course, it's okay to have all the ambulances online that we want to have, okay? And by saying that we were able to respond with a lower amount of ambulances adequately is because of our tier response program. We have EMTs on every unit. We have supplies for them.
I
to be able to
understand
respond.
that.
Yeah.
So you're saying that even without ambulances, we have response units, yes?
Yes.
And that's excellent. We've got paramedics, we've got very trained people going out there to provide care, but we cannot provide transport. So again, my question is, do we need 8 for transport vehicles, or do we not?
Well, we want 8 up and running.
Okay. And this article from September says there were that you have a fleet of 15.
A fleet of 15, but 8 that we operate.
Okay.
Yeah.
So 8, and now we have 5. So you're going to purchase 5 more?
Yes, because the fleet is aging. An average ambulance life expectancy is not long. I mean, you're looking at 3 to 5 years when you want to start looking at replacing them. So the vehicles that we have right now, the ambulances we have now, have already reached their expectancy to be replaced. So that's why we're purchasing additional ambulances this year.
Okay, and you're saying that that is going to come in when? Because according to DOA and some of the articles, you're still in the specification stage.
Yeah, I've been talking with them since assuming the duties, and we'll be sitting down with them next week to go over the specs that we have to make sure that everything is reading accordingly and see the timeline, and we'll be able to start working on the bid process. But we have turned in specifications, they have questions on it, and then we're going to be coming back with them and sitting down with them and talking about that.
All right. When were the last ambulances purchased?
That we purchased ambulance, I believe, was in the was it about 6 years ago? About
6 years.
7 years ago.
With a life expectancy of 3 years, you said.
Mm-hmm.
Are these 5 new ones that you expect to, if you send out the specs, it takes a year for them to custom make these things? Is that correct?
Depending on the manufacturer and the vendors, okay, and how we can get the solutions. Sometimes it can be a little quicker. We've had purchases in bids awarded to where the ambulances didn't come in for a while because of supply issues and supply chain issues. Of course, I don't anticipating supply issues and supply chain issues happening now since we're so far past COVID, but it was always an issue of semiconductors, the chips and stuff that go into it before. So it's all the process now when it gets to the manufacturer through the vendor locally that we get it built. So it could be built within a 6-month period and receiving it.
So you're actively pursuing this right now. So you hope
Yes.
if you can do the specs, get that procured within 1 month or 2, and then
Yes.
get 6 months to 1 year for the actual construction of the vehicles and shipment to Guam.
Yes.
How is that going to be paid? Who's paying for the ambulances? Is this from Congress, ARP money, or local funds, or what?
I have to see the details on the purchase because these are all being done prior to my taking office, but I do believe it's through the budget and in the ARP funds. I'm not totally sure.
You're not sure?
Yeah.
So we've had no new ambulances in the last 6 years.
Yeah, we had purchased the van types prior, the last time we purchased.
Okay. And we say the 4, in September you had 4, now you have 5 ambulances up and running.
Mm-hmm.
And we have alternative response vehicles without transport capabilities. These are causing some delays for transport, right? And one of the senators, I think, referred to 2-hour delay or 2-hour waits for
I'd have to
transport.
research that one.
Okay. Well, we have had hearings on different things, and ambulance response time is a big one. And I'm not sure if they get confused whether, you know, it's EMTs are not responding, but because you're saying EMTs are responding promptly in all, you know, every situation, but it's just a transporting of them, but especially from those in the south saying there were none.
Yeah, I mean, I do hear those, but I pull up our data, and for our average response time, it's still within the national average.
Okay.
And there.
Okay, that's great.
Yeah.
There was in September, an article saying that the governor by executive order had established a trauma care regional advisory council.
Yes.
And this is different from the EMS commission.
Yes. I'm sorry.
And
yes.
this trauma care regional advisory council, has it come up with any findings regarding the number of ambulances, or why we have ambulances that have not been repaired, or why we are getting to these situations of ambulances, you know, less than 8 ambulances at any time?
Okay. So the Guam Regional Trauma Advisory Council, it was just formed. I have not convened a meeting with them yet. The idea of that council is the fact that Naval Hospital is pursuing a level 2 trauma center, or level 3 trauma center. In order for our community to be able to take advantage and support that trauma center, we need to have a regional advisory council and establish a response capabilities, rehab capabilities for outpatients, for trauma-related care, because right now we don't have anything in place. So that advisory council is going to be put together to help formulate and come up with solutions on everything we're going to need locally.
Okay, I suspected it was something like that.
Yeah.
And what about the EMS commission? Have they discussed the lack or the maintenance of the ambulances?
We haven't discussed it lately. We haven't had a meeting for a little bit. There was a meeting this morning, but I wasn't able to attend because I was at the funeral.
All right. How are you going to ensure that this doesn't happen again? If we're saying there's some shortage of parts nationwide, or, you know, the supply chain, we can't predict. We have, I don't know, it just seems to me if we know the ambulances are only good for 3 years, then we have to be purchasing every 3 years. Is that making sense?
Yes, and that's the plan, is to put it in, and I know that's been the contingency plan that we've been wanting to do, is, you know, put in a request for a fire truck after, you know, like every 3 years, and put in a request for 2 ambulances every couple of years. And then we just have to work on budget constraints and funding sources in order to do that. And again, that would be my, one of my goals to do, is to make sure we get additional ambulances purchased and also other emergency vehicles.
All right, and then as to the repair of the ones that are down, you said you can get 1 to 5 of those repaired. You've issued POs for 1. What about the POs for the others? Why aren't they all being issued, like, already?
Well, the current POs that have been issued were during this previous fiscal year, and then when these other additional ambulances needed repair, at that time, GSA had closed for the end of the year, and they have not reopened for the requisitions to be submitted. So according to my finance officer, we'll be submitting those requisitions for those ambulances to be for procurement for their repair.
When? So you're saying GSA doesn't accept anything from October 1 until we're already in the 23rd already? When is GSA going to be open to accept
I can't
procurement
answer
of
to that.
our emergency parts?
I can't answer to when GSA is going to be
You have
open.
no idea? So what are they telling you? You're just going to wait till they're ready?
No, I'll be having discussions with them. I've talked to my finance officer, and we don't have a set date yet, but we are talking to them about our specs for our ambulances to be moving into the bid process.
Specs for the new one. I'm talking
Yes.
about the repairs of the current ones.
Yes,
the POs.
we're talking with them and wanting to get our requisitions in. And then, you know, I mean, right now they're on to be submitted to GSA.
To be submitted.
Yes.
All right, thank you, Madam Chair. I see my time is up. Cesius Masi, Chief.
Sujus Masi, Madam Speaker. Senator Paris, you are recognized.
Thank you, Madam Chair. Good afternoon, Acting Fire Chief. Yeah, so I think a lot of the concerns have been stated, before regarding, how do we get to this place? And I know you answered quite a bit of it in regards to, well, actually, maybe if you can reiterate. So, to me, maybe it's not clear how is a fleet managed? So it would seem like if it was managed properly, we wouldn't be in this situation. Because if you're saying that it takes the lifespan of an ambulance is 3 to 5 years, why wasn't it purchased to ensure that there was a fleet already there to support the decommissioning of an ambulance?
Well, I do know that during the COVID time and immediately after that, there was supply chain issues, and it made it an impossibility to actually put in specs for new ones because there's such a backlog on the manufacturing of ambulances that it would have taken 3 years to get anything to progress towards manufacturing. So now we're able to move forward with these purchases because the supply chain issue has been resolved.
Okay, and so just to recap, you have 5 ambulances currently, and you expect to get 7 up and running by the end of this month?
No, I expect the 2 that are already at the vendors to be getting their parts in to be able to repair them within the next month. I anticipate that. And then we have the 5 that are waiting for requisitions to be given POs for repair.
Okay, so 5, sorry, can you just go back to the numbers? So currently we have 5, right?
We have 5.
Operating, and so you are waiting for the PO for 5 more, for the parts?
Yes.
And service?
Right, and waiting for 2 to be fixed at the vendors.
Okay. So when you purchase vehicles, are they used vehicles? Are they brand new?
They're new vehicles.
Brand new, okay. And do they come with warranty? And
Yes, they do.
Okay, and so I guess the question is, if they have warranties and the expected maintenance is already covered, why are we waiting in the state? Why are we in the state, basically, if we already know that they're going to be maintained and fixed, right? Can you explain to me?
Well, I do know when we get warranties and PM contracts, it's for normal wear and tear items. What exactly they're down for, I'd have to look at the exact reason, but certain items are not covered under warranty. These ambulances, I believe, probably have already ended their warranty period, but at this point, in order to have them fixed, it goes to the vendor because our maintenance division is not able to fix them with what needs to be fixed.
Okay. And when for cases like this, is the cost low enough to meet the small purchase threshold?
Depending on actually what it is that needs to be fixed. So again, I would have to look at the specifics at that to determine what the requisition is going for and how much the value is on that, if it's going to be for the small purchase.
Yeah, I think that's critical because we're here entertaining a bill to change procurement law. And so I just wanted to see to what extent have you utilized what's currently available to you that's, can be used expeditiously, such as small purchases. So that's a key thing that we need to know. The other thing is emergency procurement. Has your agency used it to address this issue because this is an emergency? To what extent have you used emergency procurement for this?
I haven't addressed it yet, but I have addressed our concerns with what we have this month with the governor's office and the fact that they've been assisting with making sure GSA is able to release the POs that we're awaiting to have ambulances repaired, and that's been done. And the fact that we're going to be able to have up to 6 ambulances, 7 ambulances by the end of this month is what's been helpful to us. And I'm just still getting into it, so where we're going to go from there, we'll have discussions on that.
So you're not aware if you use emergency procurement or not for
Not at this time, yeah.
Okay, so do you know you can use the emergency procurement,
Yes, I'm aware that that is an option.
but you haven't used it at all?
Not since I've been.
Okay,
acting.
because, that's very quick. You call for 3 positive quotes, it could take less than a day to do that. But I guess maybe the question is, why did you choose the longer route
Well,
versus?
the process was already in place as I was coming in, and so it didn't seem that going into emergency procurement was needed because already we had purchase orders for the ambulances to be repaired that were waiting to be repaired, and so the quotes were already there. As far as the ambulances and the specs are going to have to be cleaned up, not cleaned up, but they're being reviewed for any concerns that's there, and we should have that wrapped up, start of next week. And
So when you talk about specs, you're talking about purchasing new ambulances?
the new ones, yes.
Okay.
Yeah.
And are you planning to use emergency procurement for that?
For those,
Yeah,
I will have that discussion with the governor's office.
okay. How long was the requisition waiting? So you said, obviously, you just stepped into this position, but how long was it at GSA waiting for action?
I'm not totally sure on that. When I did take it, I think it was there for maybe for a month or so, and I asked him to check on it and move it along.
Do you know why it took a month?
No, I do not.
Has it anything to do with the FMIS system?
The what?
The FMIS system.
I'm not familiar with that yet.
Do you need financial management information system, the one that was newly procured? And there's a lot of glitches?
I'm not aware if that was an affecting matter.
Because, that's critical. If we're going to use a system that's not, it's delaying the process. If that's the root of the problem versus, and obviously you didn't use emergency procurement too, is another thing.
I would have to look into that to see if that was any
what the root
factor.
of the problem is.
Yeah. I'd have to look in to see if that was it played any factor at all.
Yeah, because we don't want to be in this situation. We want to be able to, be able to procure this because this is to me, this is an emergency. We need to get, we're down to 5 potentially. They go through a lot of wear and tear, like you said. And so we already have to play catch up to, we're not at the threshold level of what we need for our community. Do you have enough in your budget to pay for the amount of vehicles, the ambulances, for the new ones as well as for the repairs of them?
For the repairs of the ones waiting for the requisitions, yes, we do. And as far as the new ones, the funding source from that, I know it might be coming from the ARP money, from what I remember. We had discussed that, and they were informing about that. I believe it may be from the ARP money.
To what extent the vendors, so are there a limited amount of vendors out there for repairs for the ambulances? To what extent is that an issue?
Well, we put out the bids for it. And certain vendors are able to get parts, and then certain vendors, and sometimes there's just a single vendor that's going to, depending on the type of repair. So that also is taken into account when the price quotes come in.
Do you expect any potential loss of funding in the coming months?
Not at this time.
All right, so do you think you'll be able to use emergency procurement to obtain vehicles expeditiously?
If that's an option that would be needed, then I would have that discussion with the governor.
Okay, do you think that is sufficient to get things expeditiously?
I think so.
Okay, thank you. Madam Chair.
You're very welcome, Senator Perez. Vice Speaker Barnes, you are recognized. No questions? Okay, moving on. Senator Brown, you are recognized.
Thank you very much, Madam Chair, and certainly to our acting police chief, our fire chief, for being here today to answer these questions. I don't think it's a mystery that Senator Frank Blas happens to be on the 5th floor of the building that he's in, that I believe also the Guam Fire Department occupies. So I don't know if there's a symbiotic relationship between the walls. But Chief, I get the impression that I think there are other firefighters that may not share the view that things are as comfortable as you may try to appear. I've worked in an agency where we have very specialized equipment, very expensive equipment that requires unique parts that are not available on island. It almost seems like it's the standard of the government of Guam to have this problem, this chronic problem, but it is possible to overcome. It is possible to have an operation where you can facilitate getting the parts you need, and then at the same time also put a schedule in place to ensure that the lifespan of the equipment, as you're saying, it's not as long as a regular vehicle, obviously, because of the wear and tear and the use, but also having a schedule in place so that there's an automatic action to procure new equipment as they're needed. So we're not left in this situation. One of my first experiences at DPW when I became the director is to go out in the back of that facility, and you know, I saw the graveyard of Guam fire equipment, Guam police equipment, and a whole bunch of other junk and buses and everything that were piled back there. You know, and things were just left to decay. And so it is possible to manage an operation, and we keep hearing it's procurement, it's procurement, it's procurement. But I don't know whether or not procurement involves all the requirements that are needed to process the documents. In some cases, we hear from GSA that not all documents get submitted, and therefore they don't get processed. We have heard the understaffing of GSA. We don't currently, I'm aware, have a permanent chief procurement officer, and that may be the case. But what I have to say, and I say it because I speak from experience, you need persistence. I know you've just recently been put in this position, so it's you know, it can't put this on your shoulders. But you need persistence to follow up and follow through. Maybe you might want to ask for a special delegation of the authority to do your own procurement. Other department and agencies do have that. When I was at the port, GSA had that authority, so we were not able to just do our own procurement on our own, but we were able to address those concerns. We also had reserve capacity. As you mentioned, you may not have a need for all of these 15 ambulances to be operating at the same time, but you have the ability to have reserve capacity. So if one is down, you automatically have one that's ready to go. And in your field, as you know more than we do, you provide life-saving support to this community. And I know we don't have a comfort. A number of us here don't have a comfort with only 3 or 4 ambulances. I was just driving up north yesterday, just driving here to Agania and then up on Route 4, and just seeing the amount of activity of the ambulance in front of me. When I ran out Route 4, it's coming down the hill from Joni. I said, wow, these guys are busy. And, you know, it's a sad reality, but at the same time, you know, we have challenges of members of our community. There are friends in our family that need that support. And also your firefighters, the men and women that provide this service, who have the skills and capability to do so, who want to provide that support to our community, but when they don't have the equipment and the tools to do it, it makes it very difficult. And we certainly don't want to be in a situation, and you know, like I said, better than we do, time can be the difference between life or death, or severe impact to someone's health that may be permanent. If you're a stroke victim, if you have a heart attack, which are common ailments that we have in our community. So I don't have questions for you because I've already heard you know, the questions my other colleagues have asked. But I have to tell you, and I will say this, maybe you know, my good minority leader might be a little more reserved to say it, but this is an issue that could be dealt with administratively. The governor has the ability to call, you know, she has the executive order power to call an emergency and facilitate what's needed. Of course, there's a set timeline, but our understanding is a lot of the challenges have to deal with the actual parts that are needed to help facilitate, get those parts and get them in the ambulance, because ultimately what's important is the ability of the Guam Fire Department to be able to provide the service, not just with the technical expertise of your people, but the ability of having the equipment that's needed to perform that job. Otherwise, their job is harder. You know that. You've been out in the field. You've seen it. And so this bill is really intended just to facilitate and assist the Guam Fire Department. It's another tool in your toolbox But I hope in the future that there are more, certainly if you are vying for this position, that a lot more concerted effort would be put in place to ensure that we don't end up in this situation again. But thank you very much, Madam Chair, for the opportunity to comment.
You're very welcome, Senator Brown. Senator Lujan, this is the first round. You gave up your time to the minority leaders, so we'll catch you on the second round. Okay, Senator Fisher, you are recognized if you have any questions. No questions. Senator Kanata, you are recognized.
I have no questions.
No questions.
Wish him all the best.
Senator Nicholas, you are recognized if you have any questions.
Thank you, Acting Chief, for appearing before us. Was there ever a time when you guys repaired the ambulances yourself?
We have a maintenance division that does routine maintenance and keeps our unit up and running as much as they can. It's just that when it becomes a problem that is beyond their capabilities, then we have to put it out to a vendor.
Okay. And who's the main vendors? Are you able to disclose that for us?
Excuse me?
The main vendors?
That varies, and I don't have all the names of the main vendors on me right now. Yeah.
Have you heard of the incident in which that arise to that prompted this bill? The customer or the patient waiting 2 hours?
Yeah, I had heard about that, and as a matter I need to look into.
Is this common? I mean, does this happen all the time, or
no?
Was this just a extraordinary incident?
I think it must have been an extraordinary incident, because if it was a common incident when I start running our data for our response time, it would not be still within the parameters that we need. It would be more reflecting on that. So this is not that statement would not be something that would be of the ordinary. It would be out of the ordinary.
Yes, sir. I just want to make sure, so because the men and women out there who are EMTs, and some of the finest folks, takes a lot of compassion to do that type of work. I always say they're angels on our shoulders, and to make types of substantial claim is very disrespectful to their hard work. So I just wanted to to thank you and to thank them for their continued service. I've experienced their services once or twice, and they're some of the best guys we know. So I just want to reiterate that, and we're here to support you, and I know you said that maybe not now, but in the future, this bill would be of substance in the future moving forward. So I just want to make sure that the services that we provide to our people are good and up to par. And I don't think there's any soul in here that would disagree otherwise. And I'd like to thank you again for you appearing here, and all the people out there who are working under you. Thank you, sir.
Thank you.
Thank you, Senator Nicholas. That concludes our first round. We're now going into the second round. I'm going to start with Senator Duenas. He's yielding his time. No questions at all? Senator Parkinson, do you have any questions?
Yeah, I do have a question, ma'am. I guess my question is, what are we doing here with this bill? I mean, I too am concerned about the reported lack of ambulances. But when the chief is here sitting in front of us, saying there is no emergency, the problem is largely going to solve itself in a short amount of time, and in the interim, there is processes in place to ensure that GFD can meet its mission. I gotta ask, what are we doing here? I mean, what time is it? Must be election season, because it seems to me that this is a solution looking for a problem. It doesn't seem to solve the problem now. It could potentially solve a problem in the future. So what are we doing here? There's a lot of talk about the difference between experience and inexperience, but is this how experience does it? Emergency sessions for non-emergencies? No public hearing for a solution looking for a problem? For a problem that it seems would solve itself in a short amount of time. Like, I'm someone who believes in taking extraordinary steps to solve problems. You know, we've done some great things with housing in here, taking extraordinary steps. And so I'm one that's willing to take extraordinary steps to solve these problems. But I asked the chief point blank, will this solve the problem? Here's the timeline. If we do nothing, this is what the timeline would look like. Would this bill shorten that timeline at all? It doesn't. And so, I don't think there's really a necessity for this bill at this time. I do think there is necessity for a bill to help GFD solve their issues, for whatever issues that they are having. But this is not the way to do it. Having some dramatic emergency session for a bill that's not needed. Sir, just one more time. Is this bill needed?
In the context of at this time, I don't see how, I already see the process working to resolve itself.
And would this bill in any way shorten the timeline of the process that you're going through?
From my review of it, I don't see how.
I'm willing to vote yes on anything that will help ameliorate and actually solve an issue. But this doesn't actually solve or do anything. And so I urge my colleagues that, you know, the thought is in the right place, the heart is in the right place, and I truly appreciate that. And I encourage once again for you to please go back to the committee drawing board, please work in cooperation with GFD so that we could actually produce the legislation that will be useful to them. Thank you so much for coming in, sir. I was inclined to support this bill, but with your information and your testimony, it's clear that there needs to be some work done to return this to the drawing board. So once again, I'd like to make a motion to send this back to committee for another round of drafts so we could get a better piece of legislation that may actually solve a problem.
There's been a motion to send the bill, the ambulance bill, back to committee, and there has been an objection. So all those in favor of sending this bill 362-37 back to committee, please raise your hand. Motion fails. Senator Parkinson, you have 51 seconds.
Thank you so much. Well, I don't think that this bill is going to do anything, but even with the small possibility that it could help in the future, I truly hope it does. I truly hope it does. And for the people of Guam at home, you know, we are going to do everything we can to make sure that Guam Fire Department can meet its mission, but I like to have some substance in my work, and I want to make sure that the things that we do will actually solve the problem, and this is not it. So with that, Madam Chair, I will yield the rest of my time, and thank you so much, sir, for your testimony. I truly appreciate it.
Senator Barnett, do you have any questions? No questions? Curtrice Chalahi, you are recognized. Any questions?
Yes. Thank you. So we're being told by some that there is no reason to be here, there's no emergency, because we should just be satisfied that we have 5 working ambulances out of a supposed fleet of 15, out of a requirement of 8. I don't find that satisfactory to anyone who's had to wait for those ambulances, for those people in the South who come in almost for every other hearing that we have regarding health care, urgency, saying that their ambulance needs are not being met. It's not clear to us today, although we're being assured by the acting chief, and I understand, that you were just appointed acting in September or October?
Beginning of this month, October.
October. So just for the last 25 days. So I understand, but there's no one in this room who's been able to assure us where the funding for the promise of 5 new ambulances is coming from, and whether, and all we know about that is that the specifications are not even done, and that these are built, custom-made, so that's going to take a while. And I think that is an issue for us to wonder or to solve. How did it get to this? If we just turn the other way today, will this just happen again? It's really that. Unless you say 5 out of 8 is good enough. And if it's good enough, then where did we come up with the 8? So obviously, it's the Guam Fire Department that has determined 8 is what they need. It's in the articles, it's in the chief's testimony today. They're required to have 8. They are making do with 5 because of the excellent backup that they have in other services. They can respond, but they cannot transport. So we have no assurance where the funding for the new 5 machines are coming from, or how long that is going to take. And I say we should have some assurance before we leave here as to how that is going to happen, so that the people of Guam can be assured how that's going to happen and how soon. Because while we wait for the 5 new ones, these 5 that are currently operating, there were only 4 operating in September. We're in October, there are 5 operating. There are so many waiting for purchase orders for parts that need to be repaired. And the best that we're going to be able to do in the next month is 7, and that's on a promise again that purchase orders are going to be received by GSA, which is apparently closed to the Guam Fire Department's request right now, that these purchase orders will be released, that the manufacturers or the companies that we're issuing these purchase orders to are actually going to be able to deliver those supplies or make the repair. That's really the issue, and it's just confusing, because in September this was a big headline, almost the exact same situation, and yet I don't know, it looks like some ambulances are going up, some are going down, and we're back to 5 only. But I think it is a problem that GSA is closed to issuing purchase orders right now, if they're going to be treating this urgently, which they have all power to do. I think perhaps no fault of the new acting chief, but the failure to purchase any new ambulances in the last 6 years, when these, according to the acting chief, are only estimated to last for 3 years, is very clearly a problem. I don't think that's something that we should turn the other way to. And I don't think anyone here can deny that a shortage of ambulances is delaying response time, and that's really the bottom line. So is there any solution to that that we can come up with? I think it's worth trying to see, and I'm going to ask the acting chief again. Is there anything else, if you don't like this bill, that we can do in the interim that's going to help you to get these ambulance transport services either up and running or contracted out or available for the people of Guam?
Like I said, our current situation with procuring ambulances, you know, we've gone from 4 from last month to 5 now. We have 2 more coming back online as soon as the vendor has fixed them. And I anticipate that being within the next 30 days. The requisitions should be able to be received by GSA shortly, and we should be able to get a PO for those to be done rather quickly because they already know their priority, and we should be able to move quickly with that and getting those back online. So as I do appreciate any help that's offered to us in order to keep us at the levels that we need to be and put us at the levels we need to be, now and in the future is something that's always, you know, welcome.
Thank you. Are ambulances required by statute or by law, according that you know of, to be in any certain places? For example, are they required to be when there is a large gathering? Are they required to be there when there are manamko? Are they required to be there during sports events?
Well, there's no, for large gatherings and stuff, there's no actual requirement, but there's requests for having ambulances there. For GDOE functions as sporting events, they require that they have somebody on standby that is able to provide care for people who maybe get injured. It not necessarily needs to be an ambulance, but it needs to be somebody who's there that's EMT certified that can provide care and have the necessary bag that has, you know, first aid materials in it that they can give care to.
All right. Thank you. Thank you, Madam Chair. My time is up.
You're very welcome, Speaker Terlahi. Senator Paris, do you have any questions?
Yes, I do. So in the bill, it states special crisis procurement procedures shall not be used for contracts exceeding 60 days, provided that if the development time for the good or service exceeds 60 days, the contract shall not exceed 120 days. And so if we're looking at procuring either service for repair or purchasing new ambulances, is this a sufficient amount of time for you to get that procurement done?
Well, for procurement of new ambulances, I don't think 120 days is going to be able to meet that need because it'll take longer than that to get everything moving. For parts and stuff, it all depends on the type of part and the supply chain issues. You know, 60 days could work, and, you know, 120 days could be, you know, they should have it by then. But again, those conditions and how we can be met would remain at the time of the type of service that's going to be needed and type of repairs that are going to be needed.
Okay, because you know, how quickly the requisitions process too, right? And you were stating earlier it took a whole month, right, before the requisition really got processed.
Yeah, that's my understanding.
So it's already half of the amount. And then the supply timeline too is like, so what is the average timeline to get?
Yeah, I don't have the exact average time of getting parts and stuff on an island for repairs that they don't have parts available for, because sometimes the parts are special parts that a vendor's not going to necessarily keep in stock for other, because we're the only ones that are going to be, you know, getting those, and it doesn't happen all the time.
Okay, the other question I have is for the new vehicles. So specs, are you looking at specs of what the government needs? Are you looking to have it built for the government? Is that,
But normally in the past, we've done specs for the ambulances that we need. Then it's put out to bid for the bidder, for the vendors to be able to bid on, and then they would go to their source as far as the manufacturing stuff, and then have it built.
so, I mean, it would seem like ambulances are pretty standard. You know, how often do you have to update the specs? I mean, I would assume, I don't know if this is true, but, you know, you can buy ambulances off the shelf sort of thing, because they make them, no?
They
On a
don't-
regular basis?
we don't buy them off the shelf.
For jurisdictions? I mean,
Yeah.
isn't there like a standard?
They have standards,
spec?
but ambulances are not usually, they're not built and put on a lot for people to buy for the most part, because, you know, for how they're purchased and stuff, most jurisdictions buy an ambulance according to their specs, and then it's put together by the manufacturers in order to meet that need. If they, you know, they don't generally create a large lot full of ambulances for people to just come in and pick. And it, you know, so, and it doesn't, you know, if we do that, then we get certain specs in an ambulance that we need. It's not going to be available in order to be able to meet, you know, for example, we get an ambulance with a certain type of stretcher and mounting system for our system. So if we buy an ambulance, new set of ambulances that doesn't meet that same spec, then we can't, you know, use the same equipment in different ambulances. We'd have to then spend more money on buying different equipment in order for it to be compatible. You know, we wouldn't, you know, when an ambulance goes down, we can't take a gurney off of one ambulance and put it onto another if it has different mounting systems. So we try to keep within the same configuration, so we're able to cross-fit things.
Yeah, I guess the universality of an ambulance, I think that's, you know,
Yeah.
that's very important. But it looks like there's different models, and you have to be
Yes,
very,
and then,
very particular.
Yeah.
Okay, so it looks like this bill is really about more of repair than purchase.
Mhm.
That's what it seems like, because if you're looking at the timeline, the contract cannot exceed 60 days or up to 120 days.
Correct.
At this point. Okay. What is the lead time for, you know, once we set out, for instance, you award a contract, what's the time, how much time will it take for the ambulance to get here?
Once the bid is awarded, like I say, it could take anywhere from 6 months to longer, depending on where it's coming from and any complications they have during manufacturing. Average, we've been able to get it within 6 months. There has been periods of time where we couldn't get it until later because of whatever manufacturer complications, and then the vendor had to submit amendments to the timeline.
What's the average cost?
That has gone up in years. Right now, we're looking at price quotes of, you know, between $100,000 to $200,000. So exact price quotes that are going on right now, I can't say.
And are they purchased from local vendors or off-island vendors?
Local vendors.
Okay, and how many vendors are out there that are?
It depends on who wants to make bids.
Bid.
We've had bids from different automotive vendors and heavy equipment vendors, depending on the specs that are being asked for.
Okay, I think that's it for me. Yeah, thank you. Thank you, Madam Chair.
Thank you.
You're very welcome, Senator Perez. Senator Brown, do you have any questions at this time?
Thank you, Madam Chair. I did want to ask our acting fire chief, is there any reason you don't have any of your first responders or any of your other personnel from the Guam Fire Department that do respond to these calls for assistance and ambulance service under emergency circumstances, that you don't have them here with you today to respond to questions?
No, I mean, I was asked to come down. I came down to discuss, so I didn't, you know, anticipate I needed an additional voice to sit in with me today.
Oh, thank you for your answer, but, you know, Madam Chair, I have to say that this bill did not come out of the thin air, and I doubt that our main sponsor, our Minority Leader, Frank Blas, just simply pulled this out of the sky just so that we could all be here this afternoon to discuss this. I think most reasonable people would agree that our current situation of only having, well, today 5, I'm glad there's 5, you know. Last week there were 4, there were some days it was reported there were only 3 ambulances operating on the island. And if you live anywhere near our main road, you are going to hear that ambulance into all hours of the night into the early morning where the need and the call is there. And in this particular case, I mean, we're not talking about other bills that have been pulled on this floor that are not life and death, but they were pulled out of committee and put on this floor, and in some cases, discussions were cut off, so we didn't even have discussion. This particular case, we are talking about life and death. If anyone here needed that assistance, if our family, our friends, members of our community needed assistance because of a health situation, a health crisis, because if you're calling an ambulance, it's something pretty serious. Otherwise, you just have someone drive you or get in the car and drive yourself. But, you know, this is a continuing reminder overall of healthcare on Guam, from the current operations of our hospital to the lack of outreach care at public health, and now another critical area, which again, these things are avoidable, even under the challenges of our current government procurement system. And it is a challenge, but it's not impossible to address this if you're persistent, if you follow up, if you ensure you have all the proper documents together, to ensure that you have an operational fleet. It has been done. It can be done again. It is concerning that we're in this situation now. And I hope moving forward that, you know, because the administrative side of the Guam Fire Department is one of the highest paid in the government of Guam. Highest paid almost in the government of Guam. We have had other representatives here that have told us that, you know, they're busy all hours of the day in that level, and hey, more power to them. But this is something critical. This is something that if we don't have the tools to do our job, and I know many of them that are working there know they need the tools, and I don't doubt that they reached out to our minority leader to ask for help and ask for assistance, because, you know, I don't know the outcome of the election. People of Guam know that, and that's for them to decide, but I don't think that's a major overwhelming concern on the part of our minority leader in wanting to put forth this bill, or those of us who have come to assist him in co-sponsoring this bill. I think this is a crisis. You can't have 15 ambulances and only have 3 or 4 on an average day operating to meet the demands and the needs that are out there in our community. They're very real. This is where we're actually talking about real life and death issues. And certainly this is something that falls squarely on the shoulders of the administration. That's the reality. They have the ability, they have the tools, they have the hands and legs to facilitate, they have the authority to do it. And it's just disturbing once again that another area that this administration campaigned on, that they were going to make healthcare better, I don't see it. And if it has to take the effort of our good minority leader to put this issue forth, to put attention to it, to facilitate whatever needs and can be addressed in the time frame to facilitate the Guam Fire Department being able to obtain the parts that they need for these ambulances, then so be it. Then that's something that I don't have any problem taking the time to being here in the session hall to deliberate. Because I think most of our people out there would agree that this is a priority, that when they pick up the phone and they dial 911 and they need immediate medical attention, they would want to ensure that they have not just the capability. We know that the first responders that do work at the Guam Fire Department, they have the training and the capability and the special desire to want to go out there and help our people. But if they don't have the equipment to do it, how are they going to do it? I don't think anyone wants to be there trying to respond to an emergency and not have the tools that they need to do that. And so certainly I have no problem taking the time today to be here to deliberate this bill, and I have definitely no problem voting on it. I want to make sure that the Guam Fire Department has the tools that they need in their toolbox to facilitate doing the repairs to these ambulances. And I hope that by doing so in this process, the fact that this is on our agenda and the fact that the Speaker has included this as an emergency bill brings to light that we are in a critical situation and that we want to do what we need to do to get things back on track so that we're not in such a critical situation, so that our people can, when they need the help, have a sense of comfort that the Guam Fire Department will have the ability to respond and be there during their greatest time of need. So with that, I thank the Acting Fire Chief for coming down and answering our questions. I wish we had more of his key people, but nevertheless, this is where we're at. And I definitely look forward to voting on this bill so that it gives them another opportunity to help facilitate getting the parts that they need. Thank you very much, Madam Chair.
You're very welcome, Senator Brown. Senator Lujan, you are recognized.
Thank you, Madam Chair. And thank you, Acting Chief, for being here this afternoon as well. And congratulations on the position that you're holding at this point. I co-signed to this bill as well, and the bill wasn't born out of nothing. Of course, the main author of the bill worked with, of course, some of the folks from your department to reach out to him, and likewise, folks who reach out to us, to our offices, whether by phone calls or WhatsApp. Doctors as well have called us and have WhatsApped us about the situation. And you know, I found I've got one WhatsApp message here that I received from a doctor, and this was on September 25th. It's a Wednesday, September 25th. And as a result of this, and I had called, or we were in a public hearing for a previous, another bill, and I was talking to the author of this bill, and he said, I'm working on a bill because for the exact same reason. But let me read this letter from this doctor, and whether or not to, again, chalk it up as nothing or something really, really urgent, because that's what prompted me to be a co-signer in this bill. What's up? There goes. Island-wide emergency transport ability hit new low this morning. While Navy base Guam went into lockdown due to imminent terrorist threat, 2 more ambulances broke down early this morning, leaving only 2 ambulances to transport emergency patients all over Guam. 14 other GFD ambulances were broken or beyond repair. GFD officials have been frantically trying to overcome Gov Guam procurement delays for the past 6 months, but today, the blank hit the fan. This unprecedented situation of grave island danger comes amid Gov Guam recognition of the essential importance of speedy, available emergency transport. Certainly, the dire ambulance shortage compromises an already fragile medical system that has acknowledged being one of the most unsafe American communities for newborn babies and pregnant women. The deteriorating situation with GFD emergency transport reflects the greater failure within Guam healthcare. Guam has gotten worse for all high-risk OB due to delays in emergency ambulance response. Guam has become riskier for stroke and cardiac arrest victims since island-wide emergency transport has been critically compromised. None of this is good, none of this is acceptable, none of this is necessary. Gov Guam is literally drowning in money. Gov Guam has nothing but excuses. Tonight, those excuses can't get you anywhere near an ambulance. So that was on the 25th. Acting Chief, should we discard this as overreaction? This is from a doctor.
No, I wouldn't discard it as overreaction. I mean, I understand, and it's dated September 25th.
Yes.
Yeah. I'm a little aware of that situation. I was off island at the time, but my understanding is, yeah, there was a day that we had ambulance up and running, but then for a few hours out of the day, we did have, it had gone down by a couple ambulances to be 2 because of immediate repairs that needed to be done. They went out of service unexpectedly. Mm-hmm. Then they were able to be put back online within a couple hours, and we were back up to the 4 or 5 at that time. So I'm aware of that, and those are situations that we do not want to find ourselves in. Sure. And of course, we, you know, as we say, we make do with what we have, and my people will, you know, the firefighters step up and respond accordingly. And of course, it puts more stress on them, but they're on the job and doing the work, and can't help but praise them at all times that they do that much work for us.
Oh, absolutely,
Yeah.
absolutely, and we have nothing but praise to all the men and women who do as such. Mm-hmm. Absolutely, our hats go off to them to do with what they have at this point. Mm-hmm. But as you said, this was a situation that we dealt with at the time. We went down
Yeah.
to 2 ambulances. And I think, exactly, that's what this bill is, again, trying to rectify, that we would never get to, or lessen the likelihood of ever getting to that situation again, because we did have that situation where it went down to 2, and thank God, your men and women who were able to get the 2 ambulances back up to be able to get it to 4. But at that point, imagine if there was, because that was the Navy base was in lockdown, and if that was really something that that really turned into something catastrophic, we would have been not only in the military side, because you wouldn't have been able to access your military corps partners because they would have been busy, and if that situation had come outside of the gate, we would have been in a world of hurt. But yeah, thank you again to you men and women who were able to do that. But and again, I will vote on this bill, because this is what this bill is intended to do, is to again lessen the likelihood of ever a situation where we saw ourselves, and we did that on the 25th of September. And so that being said, again, thank God it was just a threat, and it wasn't. It was a false threat, but it was a good. I guess it was a good practice for us. It was a good wake-up call for us to be able to. What are we doing to make sure that if we had come across something like this again, that we are not down, because if we've had this situation before, we might see it again, and prayers that again it's not reality. But with that being said, my time is up. But thank you, Acting Chief, for your time being here. Thank you very much.
You're very welcome, Senator Lujan. Senator Fisher, do you have any questions? No questions? Okay, that concludes our second round. However, before we close the second round, I'm going to have Senator Frank Blas, the author of the legislation, end with the second round.
Thank you, Madam Chair. Chief, thank you very much for being here.
Thank you.
Okay. Couple questions I have. You says that you've got there's about 5 requisitions that you're currently in process, and
5 requisition, yes.
how long have they been in that process?
I think that it's been within a month's period, and I plan on following up on it to get them expedited.
You're just brand new to the job, right?
Yes.
Okay, it's been since May.
Yeah, okay.
For
So
a while.
I plan on trying to getting those expedited.
Yeah, it's been since May.
Okay.
That some of these requisitions, okay, have been there. And I'm glad, and if part of this process was, they called you down, or they see that this bill was being introduced and we lit fires, great. So we're going to move on these things. And then by the end of the month, we'll have 7 ambulances. What's the standard again? How many? 8?
8.
8. So right now with 5 ambulances, sometimes with 4, and a couple times you only had 2 or 3. What is the Guam Fire Department's characterization of that situation? What would you characterize it as as far as your capability? The fire department, how would the fire department characterize that situation?
Having the ambulance going down to a certain levels like that, if it goes down to like 1, of course, it's a dire situation.
Dire crisis.
Yeah, it's a situation that needs to be, rectified.
Okay. Now you say that at the end of the month you'll have 7 up.
Anticipated, yes.
At this state. So basically, you just hope that none of the 5 ambulances that you have on board now, or none of the 2 that you're going to have come on board, are going to break down over the next
Yes, we hope they don't, because we just had them repaired.
So how can we determine when they're going to break down?
It's very difficult to predict.
Very difficult. In fact, it's impossible to predict,
Yeah.
isn't it?
Yeah,
So there could be a time when it could happen tomorrow.
it could.
Right. So the process right now that we have will be able to take care of that if it were to happen tomorrow, as it stands?
Well, the process right now is going to be able to deal with what we currently are.
What we currently have.
Yeah.
But if something were to occur prior to this process panning out, what process are you going to rely on?
Well, given no other process, it would be the process that we currently have.
Okay. So there is some value to this. Although it may not help you today, it could help you tomorrow.
It could help us tomorrow. Yes.
Right. Okay, and I just want to, first off, I want to lay some of the things. This is not intended to buy you a new ambulance.
No,
That's
no.
part. And
Yeah,
I
I
think-
recognize
yeah,
that
yeah.
its intention is for maintenance.
Maintenance and
repair.
repairs,
Yes.
quick repairs, quickly, so that we can get it out.
Right.
So that it doesn't have to go through the minutia and through of the regular procurement process.
Right.
Okay?
Yep.
Which, if an ambulance breaks down tomorrow,
Correct.
okay, you have the ability, if this thing were to become law, you'll have that ability to be able to make that determination as chief, okay, to move the process
Okay.
forward.
Yeah.
And would that be valuable?
Yeah, like I said, the intention of this law is a positive one. You know, it's all for the people of Guam. And if it's something that could be a tool in the future that could
Yeah.
be used.
Could this been a tool that you could have used maybe like about 5 months ago?
No, because I wasn't acting fire chief
Well,
then.
could this have been a tool that the fire department could have used 5 months ago?
It's possible, but
Yeah.
I can't answer to that, yeah.
Right, okay, so it's timely that this legislation is introduced because it's kind of concerning. I'm sure personally, you know, for you, there'll be some level of safety and comfort knowing that there are a little bit more than just 4 or 5 ambulances that are able to respond.
Yeah, I look at the positives
By the way,
in situations like that.
and I appreciate, and I know the measures that have been taken to be able to, a Band-Aid until a medical transport is available to take an individual. You've got, you know, your personnel who are all trained, and that's great, okay? I've actually seen them in action, it's great. How much time do you need to be able to get a person who's got a stroke or a heart attack to the hospital?
Depending on time of call, if it's a witness type thing, then yeah, you want to get to a stroke patient to a stroke center within 90 minutes.
Within 90 minutes. And heart attack as well?
Actually, a stroke patient, you want to get them within a 2-hour period.
Okay.
A STEMI patient within 90 minutes.
Okay.
Yeah.
And you comfortable right now with the ability to be able to do that with the number of ambulances that you have right now, if that were to occur on a peak hour, in peak time?
To be able to accommodate that, because when you look at the amount of transports that we focus on that are dealt with that, we have met that demand because of those patients are not a high percentage of our calls, but our paramedic units are available. You know, so if you get a patient who's having a heart attack, they will perform a full resuscitative events at the scene because it's safer for the patient in that manner.
Sure, yeah, because it's safer for a level of hard ground.
And for pretty much all the STEMI patients that we've had, possible STEMI patients, we've had rapid transport of those ones. You know, we've been fortunate to have that ability to be able to transport them rapidly.
But it'd be much easier if you had at least the minimum amount of 8 as
If
opposed
you have
to
a minimum
right
amount
now
of
the
8, then the required amount of 8, then yes, it would give us that availability at a higher percentage.
And it is a better percentage and better that you can get that patient.
Anything better is better.
Anything better is better. So there is value to the bill. Thanks, Chief.
Okay.
Okay, thank you very much, Madam Chair.
Thank you, Senator Blas. At this time, we have now completed our second round of questions, and we will excuse Acting Chief from the panel, and we'd like to thank you for coming down here right away. and answering our questions. So you can be excused, and at this time, we're just going to take a short recess.
Thank you.
Committee of the Whole is back from a short recess. We've only have one amendment, and this amendment is coming from Senator Perez. So Senator Perez, you are recognized.
Thank you, Madam Chair. So this amendment basically makes sure the language, so basically I'll just read it. It's to amend the bill. Number 4, the fire chief may issue oral orders or notices to proceed with a special crisis procurement for services or goods to GFD. And so what I wanted to clear up is that, they don't automatically contract out something without getting competition as much as practicable. So basically, I wanted to tie the previous subsection 3 into subsection 4, because when you read 4, it looks as if they can contract out without getting competition. So I just wanted to reinforce that there is going to be competition when these orders are made.
Thank you, Senator Perez. Colleagues, this is on page 5, line 9 to 10. And do we have anyone who would like to speak on the amendment? Senator Blas, you are recognized.
Thank you, Madam Chair. Madam Chair, I support the amendment. I appreciate the amendment to be offered by the good senator. She's right. This will be able to make sure there's congruency between the sections and stuff. For that, it just makes it tightens it up and makes it more clear, and I appreciate her effort to be able to do that, and I support the amendment. Thank you.
Thank you, Senator Blas. Anyone else who'd like to speak on the amendment? There are no one else. Senator Perez, would you like to close? Okay. Is there any objection to this amendment? Okay. There is an objection to the amendment. I see several colleagues are not in the, I'm just going to take a short recess. Okay. We are back. Thank you for that pause. We were trying to get, I believe that Senator Fisher has left already for the day, and I don't know where Senator, no, he's left already, Vice Speaker. Yeah, he left. And Senator Nicholas, I don't see him. Okay, I think this is all that we have. So that being said, there's been an objection to the Paris amendment by Senator Parkinson. So all those in favor of the amendment for Senator Perez, please raise your hand. Okay. Amendment passes. Okay. That being said, Senator Perez, no other amendments. Okay, thank you so much. Being that there are no other amendments, I'm going to have the author of the legislation close. Minority Leader Senator Blas, you may close and make the recommendation.
Thank you, Madam Chair. Madam Chair, I appreciate the dialogue and and the concerns that were brought up by my colleagues, and that's the purpose for this body, to be deliberative and to voice their concerns as well as their opinions. I take that. I get that. But with again, I'm just going to reiterate. First off, this bill was brought forth because of the continuing concerns that plague the ambulatory transports by the Guam Fire Department. I will admit, I was kind of surprised. I just thought that this problem would only existed up, from about May, only to hear from the fire chief himself. This is something that the people of Guam have had to endure for the last almost going on a year. and I think that there's comes time when enough is enough. And, you know, while this bill is you know, brought in, this isn't a crisis time that we have. It's an emergency, if you will. Any time that you have as many ambulances as you have, and you should have more. Because as much as we want to be able to say, don't worry, it's in the process, it's getting fixed, something can happen tomorrow. We're not talking, you know, regular Gov Guam vehicles. We're talking about emergency response vehicles. And, you know, this legislation, it could be effective, it could be valuable for its use as early as tomorrow if anything possible were to happen. You would hope that this is the kind of legislation that never has to be implemented, because you hope that it never gets down to that point. But right now we are, and this is a way that this body can help the Guam Fire Department in its situation today as well as in any situation in the future, to be able to get past that crisis and make sure that the life-saving response and transport is available for our people. So with that, Madam Chair, I would like to be able to, again, renew my motion to place this in the third reading, rise out of the Committee of the Whole with the recommendation to do pass.
That being said, is there any objection? Seeing no objection, so ordered. We are now going to short recess as we rise out of the Committee of the Whole.
We're back from recess. Senator Taitagui, Vice Chair of the Committee on Appropriations, you're recognized.
Thank you, Madam Speaker. Madam Speaker, I move to accept the recommendation of the Committee of the Whole and place Bill 355-37 as amended and substituted and further amended in the Committee of the Whole onto the third reading file with legal to make corrections, including to omit the typo in Section H, as that is referred only to GDOE.
On that motion, is there any objection? Seeing no objection, motion carries. Senator Taitagui, you're recognized.
Thank you, Madam Speaker. Madam Speaker, I also motion to accept the recommendations of the Committee of the Whole to place Bill 362-37 as amended from the committee onto the third reading file with any legal corrections that need be.
All right, on that motion, is there any objection? Seeing no objection, that motion carries. We've exhausted our second reading. We'll now proceed to third reading. Is there a motion? Senator Taitagui.
Thank you, Madam Speaker. Madam Speaker, I also motion that we go to the third reading file to vote on these two bills, and with one of the bills without engrossment at this time for Bill 362-37 on that amendment, and Bill 355-37.
355 has been engrossed. It
It's
can
been
be
engrossed,
passed out
yeah.
by the clerks. 362, on the motion to vote on 362 without engrossment, is there any objection? Seeing no objection, that motion carries.
Thank you, Madam
Okay,
Speaker.
we'll get the clerks to set up, please. 1 minute recess. Please call our colleagues. We're back from recess. We're now on third reading. We'll begin with Bill number 355-37 COR. Clerks, please read the title.
Bill number 355-37 COR, as amended, substituted, and further amended in the Committee of the Whole, introduced by Joe S. San Augustine, Roy A.B. Kanata, Tina Rose Munya Barnes, William A. Parkinson, Dwayne T.D. San Nicholas, Amanda L. Shelton, Christopher M. Duenas, Jesse A. Lujan, Thomas J. Fisher, Therese M. Terlahi, Frank Blas Jr., Chris Barnett, Sabina Flores Perez, Tello T. Taidigui, Joanne M. Brown. An act to appropriate revenues in excess of the adopted revenues in Public Law 37-42, as amended, the General Appropriations Act of 2024, as enumerated in the Consolidated Revenue Expenditure Report of August 2024, and to appropriate $15,828,000 to the GPA Programa Ayuda para Itautauta Energy Credit Program from the funds collected in excess of the adopted revenue levels enumerated in Public Law 37-125.
Majority Leader, you're recognized.
Madam Speaker, I move to excuse members not present for today's vote.
On the motion to excuse members who are not present, is there any objection? Seeing no objection, that motion carries. On Bill 355, roll call.
Senator Barnett. Senator Barnett, aye. Senator Blas. Senator Blas, aye. Senator Brown. Senator Brown, aye. Senator Duenas. Senator Duenas, aye. Senator Fisher. Senator Fisher excused. Senator Lujan. Senator Lujan, aye. Vice Speaker Munya Barnes. Vice Speaker Munya Barnes, aye. Senator Parkinson. Senator Parkinson, aye. Senator Perez. Senator Perez, aye. Senator Kanata. Senator Kanata, aye. Senator San Augustine. Senator San Augustine excused. Senator San Nicholas. Senator San Nicholas, aye. Senator Shelton. Senator Shelton, aye. Senator Taidigui. Senator Taidigui, aye. Speaker Terlahi. Speaker Terlahi, aye.
Bill number 355-37 COR received 13 ayes and 2 excused and is duly passed by this body. Bill number 362-37 COR. Clerks, please read the title.
Bill number 362-37 COR, as amended in the Committee of the Whole, introduced by Frank Blas Jr., Joanne M. Brown, Jesse A. Lujan. An act to add a new subsection 5215.1 to subarticle B, methods of source selection of Article A, Chapter 5, Title 5, Guam Code annotated relative to Special Crisis Procurement Authority for the Guam Fire Department to meet the criteria set by the National Fire Protection Association Standards 1710, and to ensure that there are sufficient stocked and equipped ambulances for emergency medical responses.
Roll call.
Senator Barnett. Senator Barnett, aye. Senator Blas. Senator Blas, aye. Senator Brown. Senator Brown, aye. Senator Duenas. Senator Duenas, aye. Senator Fisher. Senator Fisher excused. Senator Lujan. Senator Lujan, aye. Vice Speaker Munya Barnes. Vice Speaker Munya Barnes, aye. Senator Parkinson. Senator Parkinson, nay. Senator Perez. Senator Perez, aye. Senator Kanata. Senator Kanata, aye. Senator San Augustine. Senator San Augustine excused. Senator San Nicholas. Senator San Nicholas, aye. Senator Shelton. Senator Shelton, aye. Senator Taidigui. Senator Taidigui, aye. Speaker Terlahi. Speaker Terlahi, aye.
Bill number 362-37 COR received 12 ayes, 1 nay, and 2 excused. Bill number 362-37 COR is duly passed by the body. We've exhausted our third reading file, our consideration of the daily file. We are now in brief extension of remarks. Is there anyone who would like to be recognized on brief extension of remarks? If not, then Majority Leader, you're recognized.
Seduas Masi, Madam Speaker, I move to adjourn today's session, subject to the call of the Speaker.
Motion to adjourn, subject to call of the Speaker. Is there any objection? Seeing no objection, that motion is passed. We are hereby adjourned, subject to the call of the Speaker.